Thank you guys for coming. Let me just do an introduction. My name is Sally Mohammed. I'm one of the co-founders of Carolina for Kibera. And basically Carolina for Kibera is an organization that was started in 2001. And thanks to the funding from Duke and UNC that we were actually able to do the building, the clinic that we are going to be seeing.
How are you?
How are you?
The same way you guys came is the same way that every material one by one was brought to this site.
That's right.
Wow.
And it's 99% of the labor force was from this community.
This clinic is a joint Carolina for Kibera CDC effort. CDC has a number of staff based here because this is the center for one of their two major surveillance sites.
The fact that we are having a state-of-the-art facility in an informal settlement in itself makes it so unique. We are using a patient care system that is computerized. We have lab facilities that are very, very modern, very, very complete. The patients can come, be able to be checked in, see the clinicians, get laboratory investigations, diagnosed, and even get quality medications.
We followed a highly seasoned and trained local healthcare worker through a number of muddy back alleys and rusty corrugated huts. Finally found a house where it's her responsibility to do a household survey every 2 weeks.
Okay, there's like a list of the whole family's name just downloaded in this. So this is like a sister-in-law. Kwa hizi wiki mbili Daniel amekuwa na kikozi. So the reason we are interviewing the sister-in-law is because we were not able to find Daniel home. Most of the time, household heads leave very early, maybe 5 a.m. or 6 a.m. to find work. So most of the time we just find the wives.
So then are you going to go to nursing school or medical school someday? Huh?
I'm doing community development.
Oh, good.
She's a doctor.
Good,
She's trying to get everybody.
Yeah, and you?
Sociology. BA.
BA and
Sociology.
Ah, good. One of you needs to be good. Would you become a doctor for me, please? Would you become a doctor?
It's so important to be able to have data that allows you to understand what the real problems are. A clinic like the one that we saw that has the ability to collect that data, connect the dots and figure out what the real issues are, and then link services and resources to the biggest problems and really be able to better measure the impact.
The Tabita Health Clinic is really an outstanding state-of-the-art clinic with a laboratory support that is going to, I think, gain lots of community recognition, acceptance. It's really going to set the standard for policymaking.
Because of the conviction of wanting to give back to the community, it's humbling to work in Kibera. Someone can be able, because of you, to have a better tomorrow and be able to do his or her job better. I think for me that is gratifying.
They had a sense of community, they had a sense of mutual interest and involvement. They really felt that the healthcare worker and the facility behind the healthcare worker was really taking care of their needs.
In serving the Kibera community, I look at the slogan the CDC, their logo has. CDC is here to provide safer and healthier people. So at any time I wake up very early in the morning, I always tell my mind, I always think in my mind that I'm going to improve the health of the community that I'm part of. So when the community is healthy, I'm also healthy. That's why I wake up very early in the morning. Yeah.